I'd like to welcome Dr. Rani Bora to our second heart-to-heart conversation on the subject of deprescribing, and also welcome for everyone who's watching. We have decided we wanted to actually record part 2 of our conversation because the first part has been well received, and we both feel that having this conversation can be of benefit to many of our clients, but also many people who are on antidepressant medication and who might be interested in coming off. So we just open up the conversation to part 2. And just to have a brief background, Dr. Rani Bora. Rani is a very experienced psychiatrist. You've worked in the NHS for 20 years, and you also are a coach, a mental health coach. So thank you for sharing you with us.
Lovely to be back. Thank you for inviting me back again, Kirsten. So I didn't put you off then.
Not at all, no. I really loved our conversation, and I had really good feedback about our connection and the spark between us, and also the information.
Yeah.
So if you wouldn't mind, I just lead us into the conversation a little bit, just give it a little bit of context. So in our first podcast, you very helpfully kind of defined what we mean by deprescribing, which is gradually and mindfully coming off psychiatric medication, because staying on psychiatric medication has many benefits, but staying too long has also some risks that are quite considerable and that we are sort of looking at here. And I've been thinking about our conversation, and I learned so much about it, and I almost feel there is a little bit of what I might call a collective blind spot, because that's why this conversation is really an important conversation of our times, because depression is continuously on the rise. So many people experience depression, and therefore antidepressant treatment is also, many people experience and take antidepressants and are interested in coming off them at some point. So it's a conversation of our times. But I think I'm thinking of many clients I have worked with in the past, and maybe a handful I'm currently working with, who are very resourceful people, mostly professionals, but they have started antidepressant medication some years back when they had a turbulent time. It may have been the messy end of a relationship, messy and painful. It may have been the loss of a job. It may have been an experience of being bullied, which was the times when they struggled and started taking antidepressant medication. And the clients I have in mind may have started in a period of maybe 3 to 10 years ago and are still on the medication, have since stabilized their lives, have since been discharged from mental health services, and continue to stay on the medication, and don't kind of dare to come off it because they kind of feel they don't want to rock the boat. But I feel, and in our conversations sometimes, in the psychology conversations we have, that there's potential side effects. So this is kind of really where I wanted to, again, sort of tap into your wisdom and expertise, Rani, and ask the question, is there a period of time that, from a psychiatrist's point of view, is a time limit that actually the medication can start being effective? And is there a time when its efficacy is running out? Is it 6 months? Is it a year? Is it 5 years? Is it 10 years? Does it not matter? So that's my first kind of question.
Thank you, Kirsten. And it's a great question. When people start medication, they will be told by the doctors, like, well, it will take about 6 to 8 weeks before you see any evidence that it's working. Sometimes, people might immediately experience the side effects, but they also are told that as the body gets used to it, they will not have those side effects so much. And for some people it's true, but for some people it's not true, and they seem to experience the side effects right from the time go, and then they end up switching medications and so on. So that bit is a bit easier to say, like, how long before I see any benefit from the medication.
Okay.
And how, how long do I have those side effects for, like the initial side effects, like the GI symptoms and so on. When I say GI symptoms, I'm talking about gastrointestinal, like, some people have,
Okay.
common, you can have nausea and vomiting, like not vomiting, but nausea and sickness kind of thing. So that's
Right.
quite common. Some people might have like the feel slow or sluggish, and all those, some symptoms might go away, some symptoms do persist. But in terms of your question is not the side effects at the moment. Your question is like, how long do someone need to be on medication for? But also when it comes to like, antidepressants, if someone, say, for example, has a long history of, having depression and so on, then people might say, well, you need to take medication for the rest of their life. Or if someone has something like bipolar, and then, you need to be on medication, like, and they say that you might need to be on medication for the rest of your life, especially the mood stabilizers. So that's the prevailing, um, consensus, so to speak. Like if someone has more and more episodes, they might have to stay on it longer. But there's nothing to say that someone has to be on medication for the rest of their life. But that's what they are told.
That's one
Um,
view. That's
yeah,
one
that's
view in response to bipolar disorder or depression as well, reoccurring depression.
recurrent
Both.
depression. So, it
Okay.
could be like, you might need to be medication. But at the same time, I've also noticed that people are on medication for very long time. When you say rest of the life, I don't know, because that will go to old age psychiatry. I'm a general adult. Um,
Yes.
but most of the people, even when they are on long-term medication, they don't seem to have peace of mind. They still seem to be struggling with anxiety and
Mm, mm,
problems with depression and so on. So again,
mm, mm,
that's where the critical thinking needs to come on. Okay, I have been taking
mm,
medication as prescribed for all this time. I was told that I need to take it for the rest of my life, but
mm,
how come I'm still not feeling any better? How come my
mm,
quality of life doesn't seem to be much better?
mm,
So that's something for everyone needs to individually think about their own life, and like, is this medication regime making them feel any better and more fulfilled, and also less side effects, or are they like, are they really struggling with the side effects? Are they really
mm,
struggling with their, with the day-to-day functioning in life? Because I have noticed that as people continue on medication, there is something called tolerance. So the
mhm,
more you keep taking the medication, at some point the medication does not have any effect, and then people do come
mm,
and say it stopped working. That's a common thing.
mm,
People say
mm,
it stopped
mm,
working, and
mm,
so then we either increase the dose, or then we try to switch medication. So that's the practice. And so in terms of your going back to your question again, like, is there a, how long should people stay on medication? I also know about a consensus by critical psychiatrists saying that
mm,
you be on medication for as long as you need, but not for, and see how soon you can come off it. Because again, going back to someone, say for example, someone has a first episode of psychosis, for example, or
mm,
a first episode of depression. I think ideally, I think normally what they are told is that you need to be on medication for at least a year after
mhm,
you get better, and that's and again, a consensus. And then you try to come off it.
mm,
But if in the meantime someone is discharged from the services, and the GPs don't feel that they have, don't feel that they can help them come off medication, then and sometimes it can be missed, but most of the time and doctors do try to help them come off medication. But it's one of those things,
yeah,
have you
yeah,
have your medication regime been reviewed, like, in order to reduce it? And the person who is saying they are going to help you reduce the medication, are they aware of the withdrawal symptoms that can take place if it's done very fast? Because
yeah.
even now, I've seen lots and lots of evidence that people's medications are reduced very, very fast. I
Mm,
hope this makes
yes.
sense, Kirsten.
Yes, so the withdrawal symptoms are, that's the risk of coming off, or the period of time that people might find very destabilizing. Therefore it needs to be supervised by a mental health professional.
Not
And
necessarily.
and
I don't think. I think
right,
ideally, Ideally, you're right. Ideally, it needs to be reviewed by, someone who has understanding. But we also know that how the services are at the moment, it's not possible to, if someone is discharged from services, from secondary services, that they are monitored very closely. I mean, GPs are extremely busy, so they will do their best. But it also depends on the person to really be understanding of their, whether this is withdrawal symptom, or whether this is like, this is a relapse of the mental health condition.
So how can I just ask you another question? How can we help our clients identify that they might have side effects from being on medication maybe for too long? Well, we've touched on that in our last conversation. What are the potential side effects of staying on psychiatric medication? So I've got, for example, one client in my mind who also has a thyroid condition, and she experiences a lot of exhaustion in a way. And she has attributed that to the thyroid condition and has been with her GP, and they've upped the medication, but it hasn't had any effect. So and therefore, it's always, how would clients, what would clients look out for to actually think, hey, I might be experiencing a side effect of being on the psychiatric medication, which may have run out of its helpful benefits anyway. So what are the side effects? I remember it's the last time you talked about emotional numbness, cognitive impairments. So I just wanted to kind of almost pay a bit of attention to these side effects again.
Yeah. I think for some people, it might be easy for them to say, oh, these are the side effects of this medication, but most people are also on quite a few different medications. So it's hard to say which one is causing, what.
Yes, it's hard to
Side effects.
discern. It's
Exactly.
impossible if you're on a cocktail
Yeah,
of
yeah.
medication. Yes.
Absolutely. And if you are on a cocktail of medication, definitely the side effects are going to be there, and but some people it's easy for them to say, because they say, I've noticed this since the increase in this dose of the psychiatric medication. So, then they might know, or they might have a switch in the medication. They might have been on another medication, now they are on something else, and they notice they notice that they're having more side effects. Because one thing about side effects is that anytime a dose is increased, anytime a medication is switched to another medication, or a dose is reduced, then the side effects can be triggered. So that's one way of knowing whether this is because of the medication, because a change in medication has happened and they are experiencing side effects.
Right, that's interesting.
Yeah.
I also have heard clients say if they forget to take a dose, one day or two, that they then experience side effects. But
So
that's more the withdrawal side effects, isn't it? That's the
exactly.
withdrawal side effects.
That's a
Yes.
withdrawal effect. And then
Yeah.
people say to me that I thought the medication was not doing anything, but when when I forget to take a dose, then I have problems. So I know that the medication is doing something. Actually, it's not the case that the
Right.
medication is doing
Right.
something. All it means is that the body has got so used to it, even if it's not working. When you reduce, when you forget to take a dose, the body, because the body needs the medication, it's a withdrawal symptom. That doesn't mean that the medication is doing anything. However, it doesn't mean that you can just come off the medication for sure. Even if it's not doing anything, you're not feeling any better, you just can't come off the medication, because it's going to be like, someone is might experience like terrible withdrawal effects from that. So yes, that's one thing. But in terms of the side effects, the common ones that I see when is the emotional. We are talking antidepressants here. That emotional numbness kind of thing. People also feel quite lethargic. They might also feel like sluggish. They might feel like they're slowing down. Insomnia is a very common side effect of, or insomnia or disturbed sleep is a common side effect of antidepressants. And although people might say that the mirtazapine helps me sleep, that mirtazapine, which is a kind of antidepressant, again, in the sleep you get is not like a deep sleep,
Right.
deep restful sleep. It might be more sedating, and it might be needed, but again, it's not like deep restful sleep. So all those are challenges and side effects of
Right.
long-term medication. The other thing I see is like people talk about like forgetfulness, like they are cognitively, or their cognition is not as sharp as it used to be
Right.
before.
Mm-hmm.
And I've
Mm-hmm.
seen that with long-term use of any medication.
Right. Right.
So these are that, but the other thing is like people say I feel anxious, I feel jittery. And
Mm,
they also talk about restlessness. Now, they might think that, oh, the anxiety is because of like work-related stress, or, because they have a like social anxiety or that kind of thing. Possibly could be that, but it could also be the side effect of the medication. Most people
mm,
don't think anxiety is a side effect of the medication,
mm.
but
But a psychological problem in itself.
yeah, they might
Yes.
say that it's
Yes.
a psychological problem. So how can it be a side effect? But
Mm,
if you don't know what you're looking out for, because one of the side effects of most medications, including antidepressant, is the akathisia. So I think I might have touched on it last time, but it's just like the inner sense of restlessness.
mm,
People feel that they need to move a little bit, or they feel
mm,
that their feet are restless, and so
mm,
even if they are at home and there's nothing contributing to do that, they are still
mm,
feeling a bit
mm, mm,
restless.
mm,
So these are things, these are the things that people need to consider.
mm,
So because sometimes if you're feeling like anxious and you go to the doctor and all you're experiencing is a side effect of the medication, if you don't know this and your doctor doesn't know this, and the medication is upped or increased, is going to make the anxiety symptoms worse, because
mm,
that
mm.
anxiety is not psychological, but is more because of the side effect of medication.
Yes.
So
Yes.
all these are important things to consider.
They are very important things to consider. And I imagine the first step is to almost to, like you said, to be curious about the person's experience and almost maybe increase self-awareness by maybe asking what am I experiencing on a day-to-day basis, almost by maybe journaling. Am I feeling emotionally numb? Am I feeling emotionally alive? Am I feeling that my focus is kind of strong or sharp, or do I feel easily distracted? So that might be a first step, almost to look inwards if it's not easily detectable. Because in a way, what I find also interesting from a psychological point of view, we understand depression to be depression or anxiety. There is often a discrepancy between life's demands and expectations and the inner resources that a person has available at this particular time. And I sometimes feel that potentially medication is almost like a pill that is trying to deal with a life problem without actually looking inside and developing resources, in a way. Because I feel that's an important part of um, working with depression, to actually develop resources, to deal with life, to deal with life's challenges and difficulties.
Mhm. Yeah, medications are not they are not a cure. Let's put it
No,
this way, very
no, that
bluntly. So most people, you say, I know it's not a cure, but it will help like me. And most people like, think that, and for them, feeling numb might be useful, especially if they're really struggling with a lot of like turbulent thinking or
mm,
emotions,
mm, mm.
and they are like heightened, they can't like even calm down, then the numbing is like welcome, at least
Yes,
initially. But
it's a way
later
of
on,
coping.
yeah, but later on, when they have had psychology and they are in a better place, that numbing also gets in the way. They don't need the
Yes.
numbing anymore, because they are looking at resources to help themselves. They are looking inwards to explore how the mind works and that kind of thing. And that time they might find the numbing, which was like initially helpful, not so helpful anymore.
Mm, mm. Yes, yes. And they might be stabilized enough to think, actually, let me do some work to help to regulate the feelings that are hard to balance in a way.
Yeah, they can do any. The longer someone is on medication, the more risk of withdrawal symptoms Not everyone will have them. Some people are very lucky to have, be able to come off it without visual symptoms, but it can happen to a vast majority of people. And also, the higher the dose of medication they are on, and for a
The
long
more.
time, the more
Mm,
risk of withdrawal
mm,
symptoms. So right from the beginning, um, alongside the medication, it's very important to explore, like, any coaching or psychological work of some kind, anything to, so that they are, looking at the resources, and they are also
mm, mm,
understanding, like, okay, I need to have a deeper understanding of how the mind works, and about, my true essence, for example, however you say that, or go through some psychological work with my psychologist. But the more they are using the medication as an opportunity to just to get the rest of the work done, and they know that this has a very limited role, the more I think they are also going to equip themselves with, the tools they need, and then they also will feel that they are able to come off the medication sooner rather than later. So
mm, mm.
I spoke to someone who is really doing a lot of work around this, around withdrawal symptoms, and he has this understanding of, like, how long someone has to be on medication so that it helps them if they are on medication, and before they to lower the risk of withdrawal symptoms, how soon they can come off it. And so, if possible, like, if they are feeling better, apologies for my dog started barking at this time, but if they are able to come off it sooner rather than later, say for example in 6 months time they are feeling much 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 better,
Mm,
that might be a good time to look
mm,
at least reducing the medication, if not completely
mm,
coming off
mm,
it,
mm, mm,
because
mm.
chances are that they will have less withdrawal symptoms, and they have also had all this the resourcefulness, they have learned all this
Yes.
ways of dealing with their struggles, alongside taking the medication. So that might be a better way.
That
At
sounds
a
good.
good time.
Like taking a more proactive approach,
Yeah,
like to actually think, okay, it's been 6 months, maybe it's time to review and think
yeah.
where I'm at.
Yeah.
I
For
also
some people, it might be 6 months. For some people, it might be 3 months before they, you don't have to wait for 6 months. If you
right, right.
3 months,
Mm,
that might be the time when you start reducing medication.
mm,
I
mm.
just add
So
that.
no, that's a really important point, that it's
Yeah,
so variable. It can be
yeah,
3 months, which is
yeah,
quite short.
yeah,
It can be 6 months, can be a year. Some people stay on for a few years. It's such an individual process. But I think I also like you pointing out the potential of a very short
yeah,
intervention
yeah.
with
It's
drugs.
yeah. Okay,
And it
going.
might also, I just wanted to also maybe add a caveat that I mean, our conversation is really sort of meant to stimulate thought and conversation. It's totally out of our sort of possibility to give individual advice, because
Absolutely.
every person is so complex, and the medications people are on can be so different. So therefore, this is really, our conversation is really meant to stimulate thought
Exactly.
and facilitate, maybe thinking about everyone's own position and what they want to do with it.
Yeah,
But yeah.
beautiful. Thank you so much, Christine, for saying that, because you're right. This is not advice. It's not saying, "Oh, I have been on it for 3 months. Now I should start reducing." No,
Mm,
no, no,
mm,
no. Don't do that. You speak to your doctor, or have this conversation with your trusted friends, so on, and see where are
mm,
you right now.
mm,
Or
mm,
maybe
mm.
you see someone specifically for this kind of conversation. But please know that this is not, we are not, Kirsten and myself, we are not saying this is what you should do, or because it's 6 months, or because it's 1 year, you should come off medication. None of those. But we are, like you said, we are just asking yourself to get curious and see,
Yes,
when will I say this is the time has come for me to at least reduce a little bit and see, how I get on. Yeah. So that's
exactly. And if anyone wanted to have a conversation with you or I, for half an hour, 45 minutes, feel free to contact us just for a brief conversation, and then we can maybe offer some ideas.